Hey, Ray, Dr. Sean Casey here with Healthcare Complete Back and Neck Pain Center, answering a few questions that have come across our desk. One that comes up periodically with patients is, well, what are all my treatment options? What can I do for my be it back pain, neck pain, sports injury, which are great questions. So any physician you want to go to, they should do a good evaluation to see, number one, what type of injury is it? Obviously, I'll see cases where someone's come in from an accident or a sports injury, and we're looking at a possible break or fracture. So we do some work with some good orthopedic surgeons to get that evaluated and get the proper doctor to treat it. That's why we always do a thorough examination. So that's first and foremost. But if it's a case of a sprain, a strain, back pain, neck pain, joint pain, one of the issues I always tell patients we're going to figure out first and foremost is what's causing the problem or causing the pain. There's a lot of things we can do to get out of pain. Obviously, there's plenty of medications out there, drugs, even the good stuff and the bad stuff, where you will feel no pain whatsoever. But is pain a bad thing? Pain is actually your brain telling you something's not functioning properly and trying to protect you and alert you. Specifically, there's disease processes like diabetes, for example, where folks lose sensation, they can't feel a problem, and that problem turns into a much bigger problem where sometimes someone will lose a foot or lose a limb because they've got an injury, they don't know it's there, and the damage gets to a point where it has to be amputated. So pain's not necessarily a bad thing as long as it's pointing us toward what the cause of the problem is. Then whenever treatment you go through, the goal should always be, is this treating the cause of the problem? Because guess what? You correct the cause of the problem, the symptoms go away. And that's one of the big things chiropractically we look at. If it's due to joints being out of alignment after a sprain, a strain, or injury, it's key to get those bones back in alignment so they function properly from a mechanical standpoint. The other big thing we know from a chiropractic standpoint is that those nerve fibers have been impinged, irritated, inflamed, and we know when the joints go out of place in the spine, there's up to a 60% decrease in the output of those nerves. If we don't reduce that nerve irritation, the body cannot function properly because that's how the brain communicates with all the tissues in the body. So by reducing that stress and helping the body heal with the proper treatments such as physical therapy, rehabilitation, chiropractic adjusting, those are the keys we use to get folks better and healthier as opposed to just treating aches and pains. Now, that's a bad thing. We want to get you feeling better fast, but we want to make sure you stay that way. And that's always the goal. I know it's kind of a thick problem. If you have any questions specifically about conditions you've been fighting or what would be the right doctor to talk to, we'd be happy to help. You can always text us at the office or give us a call. Hope this helps. Have a great day.